raised on a farm near Stanton in southwest Iowa. Joni's parents instilled in her the values important to Iowans: hard work, service, and sacrifice. Joni resides in Red Oak with her husband, Gail, and their daughter, Libby. Please, again, welcome our United States Senator, Joni Ernst.
Thank you, Dr. Cox. I appreciate that very much. And I do want to thank everybody for coming out today. This is our 13th listening session across the state of Iowa. It is part of my 99 county tour. I want to thank our government class for being here today as well and participating in this discussion. So I am going to save my comments. We all understand there's a lot going on in the federal government right now. So what I'd like to do is just go right into questions because we want to hear from you. And the way we have it set up, those that have filled out their cards, drop them into the container that we have up here. Brittany will draw those cards out. She will read the name and also get some folks queued up in the audience, those that have filled out the cards. And we have Sam and Libby with the microphones. They'll come around so that everybody can hear your question or your comment. So if you have not filled out a card, please do so, and we'll make sure that the staff picks those up and gets those included in the bucket. So we'll go ahead and get started right away. Go ahead, Brittany.
So first up, we have Jolene Norby from Osage, and on deck we'll have Patrick McDermott from New Hampshire.
Sorry. You don't have a very long leash here.
Hi, Jolene.
First off, Senator, thank you for your military service, and thank you for doing this job. It's not an easy one. We are all aware of that. I have a question about health care. Okay. For the last 7 years, the Republicans tried to repeal the ACA, spent millions of tax dollars doing so, but did not have a backup plan. That's history. Now we are looking at pushing through something that is not thoroughly thought through, but to meet a deadline. It feels like they're doing it just to say, because we campaigned on this, that we said we would. But it's not in the best interest of all Americans. I think most Democrats would agree the ACA needs some tweaking. My question, Senator, is when will we see our congresspeople come to the table open-minded and work in a bipartisan fashion to make things happen for the good of all Americans?
I think I'm going to address a couple different points. Because there have been a number of different plans out there, and the one that I understand will be brought up, the Graham-Cassidy Amendment, or Cassidy-Graham, however you want to look at it, will come up probably this next week. And it is a plan that had been proposed several months ago as we move through the repeal replace of Obamacare. What we know is that that could be a long-term solution, and a lot of us do support federalism, which is allowing those states to decide what is best for their own constituents. We know that one size fits all doesn't work in every case, and we've seen that actually with Obamacare. So you did mention that most folks would agree the ACA does need tweaking. It needs some adjustment. So in a spirit of bipartisanship, and I will be honest, I think he is a wonderful, wonderful leader, Senator Lamar Alexander from Tennessee. He is very big on working together and coming together, bringing ideas and people to the table. And so he worked with Democratic Senator Patty Murray, and they said, we will have bipartisan coffees, roundtable discussions, and hearings to find a shorter-term fix for the ACA, a fix, just exactly what you're describing. And Patty agreed to that. And he asked me to be part of those discussions because in Iowa we have one statewide insurer, one. And what has happened with one statewide insurer? Well, rates have skyrocketed. So we have families right now that are coming to us saying, we had to drop our policies and we can't afford the insurance. So the example I've given is when I was at a community north of Ames, I had a family that brought me this information. They got their rates in the mail from the one provider they can get from the exchange. $34,000 in premiums for a young family of 4. $34,000. That's not deductibles, that's not out-of-pocket costs. And so what did they do? They had to drop their policy. They have nowhere else to go for insurance now because of the Affordable Care Act. Now, if the cost sharing isn't put into place, if those dollars don't come from the federal government, which I do support those cost sharing payments, I will let you know that up front. If they don't, those rates will be even higher. So what will the federal government do now? We will go in and fine that family of 4 because they're too poor to afford insurance, even though they have nowhere else to go. So using that as the example and what was presented to me, and we've had other cases in the past, Lamar Alexander thought it was really important that I sit in those roundtable coffees. And in those roundtable discussions, we heard from insurance commissioners from all over the United States. We heard from governors all over the United States, Democrats and Republicans. We heard from activists. We heard from people in the insurance industry. We heard from all angles of this issue. And they provided some really great ideas on what we can do to make things better in the short term. So Lamar got together with Patty and presented what he thought would be the way forward. And the Democrats rejected every offer that came up on the table. Bottom line, they said, we just want the money right now. We just want the money. We don't want to change anything. We want the money. And it all imploded last week. There was no bipartisanship other than to have those great discussions, learn some really great ideas that other states would like to implement. It imploded. So now we are looking at ways that we can go forward, find some fixes that will work for the states, work for the constituents, and I think that's what we will be looking at as we move through this next week. But we have to understand it's broken, and I thought we had some great bipartisan ideas, and they were rejected. So Iowa's in a difficult situation right now, and unfortunately in the short term it looks like we're going to face those extreme costs in insurance until we find a fix that maybe Democrats and Republicans can come together on. So yes, Patrick.
Next question is from Patrick McDermott, and he will be followed by Laura Wright from New York.
Thank you, Senator.
Yep, go ahead, Patrick.
Thank you, Senator. I appreciate you showing up. I've got a question about pre-existing conditions. Mm-hmm. It's been addressed, but it hasn't been addressed. I heard this morning Mr. Cassidy, or excuse me, on Morning Joe, who was it was Jeff Flake, excuse me, from Arizona, made the comment, he said, you don't have to worry about pre-existing conditions, they'll be taken care of. But he was you were shifting it from the federal government to the states. The state was the one that's going to be solely responsible. You want to shift some of your responsibilities, is that correct? The way Flake told it. What part, Senator, are you accountable for? And I don't want to sound self-serving, but I'll bring up an example. I've got 3 children. My youngest is 24 years old. He's got Crohn's disease, was diagnosed 4 or 5 years ago. And you're fully aware, and there's other diseases out there, worse or better. It's not a matter of that. He takes a transfusion every 5 weeks. That cost about $7,200. Excuse me, every 6 weeks, about $7,200. And I said to the doctor initially when that happened, and thank God my wife's got good insurance, or we have good insurance. I said, what if he didn't have insurance? He said he wouldn't get the drug. But how vital is it? He said, it's essential. So all I'm asking is not because it's him. There's millions of them out there. And this is the part, Senator, like I said, I know you're pro-life, and I appreciate that. And here's the correlation with that. Why is it that you, as pro-life, as you are, you're concerned about that child in the womb for 9 months, but once that child is born into the air that you and I breathe, now you're on your own? Can you explain that? Is pro-life for 9 months, or is pro-lives for the entirety?
Pro-life is in the entirety. So,
okay, go ahead. I'm sorry.
I'm sorry. Go ahead, Patrick. Yes, and I do think there is a responsibility out there, and so we do want to make sure that those with pre-existing conditions are covered. I have members of my own family that have childhood illnesses which will go through their lifetimes. It is vitally important that we do that. A dear friend has a son that had leukemia at the age of 1 year. I know that maybe in the future there will be repercussions, and he will need additional care in the future. We understand that. So with the pre-existing conditions, and this is where we can envision some of the ideas that were brought up by a number of these individual states, and Maine actually had addressed the pre-existing condition issue, and those that do cost the system more, they had addressed that with an invisible risk pool, meaning that everybody that is purchasing insurance plans, they could be like a juvenile diabetic or somebody with Crohn's disease. They would buy a policy, same level of cost as anybody else out there, but they would be put into an invisible high-risk pool. They may not even know that they're in that risk pool. The insurance providers decide, is this someone we can take risk on? Is this someone we think should be in the invisible risk pool? And then there is a backstop of dollars that goes towards that risk pool. So the insurance companies would say, well, I would like this person to be in the invisible risk pool once they have met their whatever the insurance company deems as the high-level cap. Once they've hit that dollar amount, then it goes to the state, and they go into that. The dollars expended from there on out go into that risk pool, and the risk pool becomes acceptable or accepting of those additional costs. Yeah. So there's not really a cap there, and it's only capped as to the loss and what it would affect all of the additional policyholders of those plans.
Pardon me, but you're not one of them, but they stress accessibility. Everybody will have access to insurance.
Right.
You're right, they will have. But affordability is the mainstay, isn't it?
Absolutely. And that's what this plan also addresses. And thank you, really great questions. With the Graham-Cassidy bill that's proposed, of course, any waivers and this would go to the Secretary of HHS, regardless of administration, it would go to the secretary, and that secretary, to approve a waiver, that state has to prove accessibility and affordability. So I know this is difficult, but again, with that invisible risk pool, the costs are still spread out. They're paying the same as every other person, but then that risk pool absorbs those extra costs for those high dollar participants in those plans. Yeah, thank you. And I do hope, and again, not every state would opt to do that, but I think it is a plan that I think a lot of states should look at, should this go into fruition. Mm-hmm. Thank you.
Next up, we have Laura Wright from Decorah. She'll be followed by Ruth from Charles City.
I'm going to begin with just a small comment to piggyback off on that. Sorry, I don't want to cry. I take a medication that costs over $4,000 a month. Mm-hmm. If I don't have that, I become a cripple at 55 or 60. Sorry.
No, go ahead, Laura.
Ethically, do you see it as your responsibility to ensure that a state cannot offer a waiver so that they abandon me? That's my first question. Go ahead if you want to.
Okay, the states offer.
So if a state brings an offer of a waiver to the head of the Department of Health and Human Services and says, we want to do these certain things so that suddenly, what is affordability? Am I going to be paying 50% of my take-home pay for my insurance, and they determine that as affordability? Who decides affordability?
Well, the secretary would decide affordability, but as we're going through with the battle that Iowa is having right now in trying to obtain a waiver for Obamacare because folks can't afford it, they have to prove that insurance is unaffordable, and it is a struggle right now. So they would have to prove that it is not affordable for you.
So I am appreciative of Doug Omen's work on that waiver. Yes. It has been superb, and I think that insurers have promised to come back into the state if it is approved.
We are
and
hopeful.
He said today that the federal government may. The question, sorry, I felt so personal about that.
No, and that is very personal.
The other thing that feels very personal is I'm from Decorah, Iowa. We are in a rural area. Mm-hmm. The Medicaid cuts that are coming are going to affect every sector of our healthcare. So when it comes to, first off, poverty levels, the first users of Medicaid are those who are poor. If you look at the census data in 2010, the 4 counties in the Northeast are increasingly more and more poor. So they need that. Our rural Iowans need Medicaid, and to cut those payments is egregious morally to me. Second, our hospitals. Our hospital administrator came and spoke with Brittany when she came to us in Decorah and said, we need those Medicaid payments because we need to have our bills paid. We do work, we should get paid for our work. So our rural hospitals are saying, this is a problem. So there's another sector of our economy. And then you go on to our clinics in the area, and you have voted against Title X, and our clinic in Decorah closed on June 30th. It didn't even offer abortion.
Laura, what clinic closed?
It's the Northeast Iowa Family Planning Clinic.
Okay, through Planned
It
Parenthood.
closed in June 30th, and it was lacking Title X funding, and so that is a lack of access there, and we're seeing that across the state as well. And then the last sector of our healthcare is these small clinics, say, for mental health. They have said, now it's a dynamic duo of the state privatizing healthcare, privatizing Medicaid, so that they're not getting paid. And they joke about counting their toilet paper squares because they're not getting their bills paid. And then you're going to come along and decrease the amount of money you're giving them through cutting and doing Medicaid block payments. We already have a crisis of mental health in Northeast Iowa. We lack psychiatric nurses, nurse practitioners. I talked with the county commissioner, and he said we can't even get them to come here because they're too expensive. Are you then going to close that small clinic that we need because it no longer has Medicaid payments? So how are you going to justify to rural Iowa a vote in favor of Graham Cassidy that cuts Medicaid and affects every sector of our healthcare economy?
There are a lot of issues there. One, and I want to go back to your medication issue as well. And again, what I'd like to remind everybody is that what we have been talking about and what Obamacare was is an insurance bill. Obamacare was insurance, it wasn't health care. So we're addressing insurance, but Laura, what you brought up with the medication issue is health care. And nowhere have we addressed the actual expenses of health care. So that's what I want to remind everybody is when we're talking about medication expenses, you know, why is it that a medication will cost $4,000 a month? There are a lot of issues within the pharmaceutical area that we need to probably address, so that if you have a life-saving drug, it's not costing you so much. There are other issues with regulation and overhead that so many of the providers and practices and clinics have to put in place. One, we want to make sure patients are treated safely, but there's a lot of unnecessary regulation and paperwork now where our physicians are saying, I'm spending more time doing paperwork than actually seeing patients. And that doesn't bring any dollars into a clinic. It doesn't bring any dollars into their hospital if they're not seeing patients. They're just doing paperwork. So there's a lot of issues with actual health care that have yet to be addressed. And I do hope that that's something that we will focus on as Congress, you know, what's going on out there within health care and what can we do to bring those costs down. So that's one. You mentioned Medicaid, and the Medicaid dollars, even through the Graham-Cassidy bill, will continue to increase every year. So if you look at what's being expended in this current fiscal year, it's not going to decrease, it still increases, especially for those that are disabled, which we have a number of disabled in Iowa as well as our elderly. So that will continue to increase 2020 through 2026, which is the period of time covered by the Graham-Cassidy bill. So to say it's a cut, it may be a cut from what was projected in Obamacare right now, but it still will increase, and it will continue increasing for those, like I said, that are disabled and elderly, the most vulnerable in our population. As far as the clinics that exist out there, there are a number of funding streams. Title X is only dealing with family planning services, not entire services, wellness and things like that. And there are many other federal health clinics, qualified health clinics across Iowa, and we've actually spoken to that association, and they have said in regards to Planned Parenthood that even if those Planned Parenthoods would close, they can accommodate those patients. So there do exist a number of those clinics, and then we also have community hospitals. Rural hospitals, I live in Montgomery County. We have a rural hospital as well. So we're well aware of those issues. In regards to mental health, this is a crisis all across the United States. It's not just in Iowa. And it's not just about lack of funding, it's a lack of providers as well. We don't have people that are entering into going into those services like psychiatry, counseling. We can always use more of those. So it's not just lack of funding overall, it's just simply lack of providers that are available out there. Some of the biggest hospitals you'll find out there say they struggle, even offering high dollar amounts, they struggle getting psychiatrists. So there are a number of issues that need to be addressed. They won't all be addressed in this particular bill, just as they were not addressed in the ACA.
First off, you can say there are clinics all over. We are in the middle of Northeast Iowa. It's an hour and a half to drive. If you expect poor women to do that, that's a hardship. So please consider those women. And then the second matter, we have people in Northeast Iowa, there is health care for mental health. They go to Minnesota. They plan it ahead of time and they go. It is an Iowan issue.
Ruth?
And following Ruth will be Ryan Wolf from Charles City.
What do you think about the stopgap, and how will it help Iowa?
Well, I think we have to have the stopgap, and I have spoken to Seema Verma personally, face-to-face and over the phone on this issue. Without the stopgap, we could lose our final statewide health insurance provider. So the stopgap, while I don't think it is a long-term solution, it is truly a stopgap issue. And if we don't have it, I would hate to see what will happen in the next year or two. And that's why I was hopeful that through Senator Lamar Alexander, we could actually find a short-term solution that would work for Iowa. And that got nowhere. We got no assistance from our friends across the aisle in regards to that. So we are back to having a waiver for the stopgap issue, and again, it's short term. It's not going to help us in the long term. So we have got to find a solution, and I'm sure all of you agree it needs to be bipartisan. We need some folks that'll step in, help us with that. But we're not getting that. The only thing we're hearing is give us more money. So stopgap, we need it for the short term, but we've got to do something long term, or we're just not going to have any insurance providers in Iowa. Thank you.
Following Ryan will be Vince Morshay from Osage.
Hi.
Okay, hi, Brian.
On September 1st, the White House suggested President Trump plans to end the Deferred Action for Childhood Arrivals, which protects young children from being deported because of their undocumented parents. So what is your thoughts on that subject? Like, do you agree with that statement, or?
Yes, I do agree that with the president's stance on ending the executive order for DACA. And you know what that does? It forces us as Congress to find a pathway forward for our dreamers. So I do agree with what the president did. If we go back and we play the tapes from President Obama talking about DACA, he said it was only short term and it needed to be addressed by Congress. So it needs to be addressed by Congress. And I even said during my political campaign, I kind of went out on a limb against some of my own base. I said I do support DACA. Where I draw the line is citizenship. Now, I think that if we can find a legal permanent status for our dreamers, give them the opportunities that every other American citizen has, except maybe some of the citizenship rights, allow them to go to school, they get great jobs, their children will be born here, and their children will be American citizens. If they are willing to step up, and I did talk to a dreamer a couple of weekends ago up at the Clay County Fair, she just wanted to know my thoughts on this, and she said, I don't care about citizenship. She said, just give me a legal permanent status so that I can go back to Mexico and see my grandmother and come back to the United States and know that I will be okay. I agree with that. But she also said, you know what, and we were standing by the National Guard recruiting booth, and she said, you know what, I had gone to a recruiter a while back, and they wouldn't let me enlist because I don't have a legal permanent status. She said, I love this country, and I consider this my country, and I'm willing to fight for my country. And I said, you know what? If you're willing to do that, I would consider a pathway to citizenship if you are willing to step up and serve in our nation's armed services. That is very personal to me, and I know that's very personal to her as well. A lot of folks can agree that we need to come together on this, and we need to find a solution. And I think we have a place here for our dreamers. It's just the differences on the tail end that maybe we don't agree with. And so what we want to do is find a pathway forward. But it does come with some other concessions that need to be made. DACA is a one-time fix. It's a one-time fix for a certain group of young folks that are here in the United States that are undocumented. We will continue having these cycles if we really don't get serious about securing our borders. I have people say, we don't need to secure our borders, but then we'll continue having folks coming into the country that are undocumented, and we'll go through this same situation in a number of years. So I differ a little bit from many folks out there. They think we need to have open borders. And to that I say, then you're okay with all the sex trafficking, human trafficking, drugs, you're okay with everything coming over the border illegally. Because it's not just innocent people that are trying to make a better life. There are bad actors too. And what we need to do is then look ahead and find a better way to do immigration in the United States. And that should be our next step. So let's start with our dreamers. Let's find a pathway forward to them. It is our job as Congress to do that. It's not the president's job. It's our job. And so I'm there. I'm ready to have those discussions. But what we need to realize is not everybody is going to get what they want on this issue. Because just like health care, there are a lot of different opinions out there. So we just need to figure out how we come together, find a solution for this set of folks that are here that are undocumented, but then we need to figure out what we do in the future about immigration. Thank you.
Next up is Vince Morshay from Osage. He will be followed by John Shute from Mason City.
First off, thanks
Hi,
for
Vince.
coming out, Joni. Appreciate it. And I don't have
Thank
my
you.
green rural power shirt on, but
very
I'm a
good.
director up in St. Ansgar, and I want to thank you for your efforts to protect our baseload generation. And,
Yes.
And the funding from FEMA for mitigation of storms, the storms we've had this summer up in this area. The power stayed on for a lot of people. They don't realize what's going on behind
That's
the scene,
great.
how we've built resilience into the system. But appreciate your efforts. I have a budget question. Mr. Trump's proposed budget is cuts across the board. And when you look at a chart of the exploding federal debt that you've seen, it just, that's not sustainable. My concern is our small country voice in Washington, that we don't sustain an unequal cut in those. We take a bigger cut than, so just stay in there and fight for us. I think we all have to endure some cuts, but make sure that we don't get an unshare.
Well, I appreciate that. Thank you. And Vince mentioned the base load and working in the electric industry, and we visited your solar field, correct? and it was phenomenal. So great job. I want to compliment St. Ansgar and your company for doing that. Pretty fantastic. So yes, the president had a budget with some pretty steep cuts in it. Understanding the president is obligated to do a budget and propose what he thinks should be out there. However, it is up to Congress to make those decisions. So we are those that hold the purse strings. And what we need to do is spend smart for the American taxpayer and make sure that Washington is not overstepping its bounds and paying for things that we shouldn't be paying for. And so some folks follow my Squeal Award that I put out. And what I'm doing is going out and we're identifying problems with spending in Washington, D.C., and then it's up to me, my staff, to find a path forward in how we prevent that type of waste in the federal government. Just for example, we had a study that was done by Stanford University on speed dating. And I'm sorry, but the American taxpayer, I don't know that that speed dating study benefited any of us in this room. But that's what our federal government spends dollars on. And so we've got to stop that. You know, when we're talking about how much money we can spend in healthcare, how much money we can spend in defense, how much money we can spend in overseas aid, how much we can spend for FEMA, all of these things that are important, and yet we waste it on things that don't make sense. So we've got to get that figured out. Now, when we talk about the federal budget, we also have to keep in mind that we have a pretty steep deficit out there, or debt out there. We have a deficit in our budget every year, but we have debt that exists out there too, and we are now over $20 trillion in debt as a nation. That means over $60,000 for every one of us in this room. Every American share of the debt is over $60,000. And we haven't controlled our appetite yet, and we haven't figured out the pathway forward on how we start reducing that debt. So some of the things that we do tend to talk a lot about is, making sure that we are balancing our budget. That's really important. It's important to me that we do that we're not spending more than we're taking in. We also need to reduce regulation, things that don't make sense. Again, I want to go back and emphasize, we need to operate safely out there. But if things don't make sense, we should get rid of the overburdening regulation. And then we have to grow our economy. If our economy is strong, we're able to reduce that federal debt. We would be able to do that. But a lot of things that we have to do and we have to take seriously in Congress. So thank you for those great points.
Next up is John Shoup from Mason City. He'll be followed by Dennis Cole from Charleston.
Thank you. Yes, I was just wondering about the health care and the reason why you have to kind of rush it through. At least in my opinion, it seems like it's kind of a political push right now, and that the Republican Party had 7.5 years to work with the Democrats, with President Obama, and it seems to me their answer was always no, 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 and no other solutions were put forth. And I guess I would just urge you to vote no on this and go back and make an attempt to try and work with the Democrats and maybe come up with a health care plan that wouldn't hurt rural Iowa and wouldn't take funds from Medicaid from Iowa and give them to Texas and this sort of thing. So that's what I would suggest.
And thank you. I would say, though, that everybody's referenced the last 7 years and why won't Republicans work with Democrats. I would say if you go back and look at the vote that happened the night before, I think it was the night before Christmas, Obamacare passed with absolutely no Republican support. So I do want to reflect on that. Does that mean that we should be passing a bill, with only Republican support? Well, I would say Iowa speaks pretty well for itself and what's happening in the policies that have skyrocketed. Over the past 3 years, and this is prior to this year, the past 3 years, this is before President Trump was in office, this is, back going under President Obama's administration, past 3 years, the insurance rates in the individual insurance market rose 110%. 110%. So President Obama promised that we would save $2,500 per family. Does anybody remember that? And yet, 110% increase. So with this year, what Medica has proposed is about a 43% increase in our individual insurance market. 43% on top of the 110% that we've seen in the past. President Trump threatened to take away the cost-sharing payments from the federal government. Medica said if we don't get the cost-sharing dollars, that amount will be closer to 60% increase on families in Iowa. So we had at least five that were well-known, 5 plans that existed from previous years that Republicans had proposed, but none were taken up. So when we went into January, we had different plans proposed that Republicans wanted to see. And it's really hard when you kind of entrench yourself into one bill or another. It's hard to bring everybody together. And so we explored a number of different options, and we ended up with several. We voted on several different options in July and came up with nothing. So we had to go back to the drawing board. And that was the attempt that Lamar Alexander had with Patty Murray. That was coming together, exploring different ideas, working together in a great state of bipartisanship. And I can't believe, I guess maybe I'm Iowa nice, I don't know. Every day as I walked out of that room after having coffee and that roundtable discussion with the bipartisan group of individuals from all of these states, all across the United States, all of these people providing ideas, I'm thanking Patty Murray. I'm like, thank you, Patty, for doing this. I think this is great. We're finding a way forward. And Lamar was duped too, because at the end of the day, they said no. No, we're not going to take up any of these ideas. Even those presented by the Democratic insurance commissioners, the Democratic governors, they weren't going to take up any of that. They just said, give us more money. That's not solving the problem. So you can tell I'm frustrated now because I was willing to engage with my Democratic friends, and I do actually work a lot with my Democratic friends across the aisle on a number of issues. And they said no. So tell me how we find a way forward when we are willing to step out. We're the party in control. We were willing to accept some of their ideas. And all they said was just give us more money.
Senator, how come your own party, which has had control, couldn't pass health care twice? You can't continually blame the Democrats.
No, I can, because we're listening. We're listening. And that's exactly what John McCain had said when he came back was, let's get everybody together. And that's what we did. That's what we did. These last several weeks between Patty Murray and Lamar Alexander, they have been meeting. So, absolutely, I do. Absolutely, and that's why I think we finally found a way forward. Yep. Okay, and we have got. I think Dennis.
Yes. Our next question is from Dennis Paul in Charles City. Dennis will be followed by Leah Mark from Rudd.
I want to thank you for your service.
Thanks, Dennis.
I was a Vietnam veteran, and I retired out of your sister unit out of Mason City.
Oh, the 1133rd.
And
thank you for your service.
My question is, Thank you. A lot of my military records have disappeared. I've tried to get them from St. Louis. It either comes back, no record of service, or I get my National Guard records. How can I find my Vietnam records?
We can help you with that, Dennis.
Okay,
And what I'd ask for you to do is afterwards, we're going to get your information, and we can help you with that. We've been able to go back, even stuff that was lost through the fire in St. Louis. We've been able to track some of that down.
Okay, thank you.
Yeah.
I was wounded in Vietnam, and I was treated in a evac hospital, through the front door, treated out the back door. I never received Purple Heart, and that's what I'd like to get.
Okay, let's do some work for you. Thank you for your service. God bless you for doing that and stepping up to the plate. We will help you track those down. So I want you to see either Sam, Brittany, or Libby afterwards, and we need to get your information.
Next up is Leah Mark from Rudd. She will be followed by Steve Hubert from Charles City.
Leah gave me the opportunity to talk. I'm Ellen Dahl. I have a son, Matthew. Sometimes putting a face with the question helps. Matthew has Down syndrome. He's 44 years old and lives in a group home in Clear Lake. The Medicaid funds that will be coming would be block granted to Iowa, correct?
Yes, they would.
Okay, we have managed care right now. I'm seeing the effects of managed care. My son has lost his dentist. He almost has lost his primary care physician. How can I trust you to make sure that he gets the services he needs? Dentists aren't being reimbursed adequately. Physicians aren't being reimbursed adequately. My trust level is very low right now. This is a person that can't speak for himself. And many of the people in his group home don't have advocates. How can you assure me that he will get the services he needs?
Well, we certainly want him to get the services he needs. So that's why those Medicaid dollars going on into the future, again, will be focused on the disabled and the elderly. Rural areas do tend to have reimbursement rates that are very low, and I think that is an issue. So again, focusing those dollars on the elderly and the disabled is the way that we should do business.
But there's less money.
The dollars will still increase. You won't see cuts from this current year. The dollars still continue to increase.
Lower than they're supposed to be.
Well,
Lower rate. He will not be getting the services in the future that he's getting now.
okay, well, I would have to see those dollars and figures and figure out why he's not being.
That's true.
Yeah, okay.
Next up is Steve Hubert from Charles City. He will be followed by Ashlyn Bauer from Charles City.
Thank you, Senator, for your military service and your willingness to stand up and serve in a body of elected people that don't get along very well.
Yeah, thank you.
Have you, in your time since Donald Trump was elected, had a chance to experience the difference between his administration and the previous one as far as workability and getting things done?
Absolutely. Absolutely. It is night and day. During the President Obama administration, I was invited to the White House once, and that was because I was a newly elected official. And that was a meet and greet where you go through, you grip and grin the president's hand, and that's it, period. There was no other contact with the White House. And in this administration, I have had the opportunity to work with not only the vice president, but the president on a number of issues. I think our entire caucus, Republican caucus, has been invited probably no less than 6 times to the White House to engage in direct discussions with the president. And the president also does discussions with the Democrats and the Democratic leaders. As you have seen, he is working with Democratic leaders. And our friends across the aisle, I've had some of them tell me, never was I ever invited to the Obama White House. So we have a White House now that is very open to discussion, very willing to engage with members all over. We have folks here in Iowa, normal, everyday people that actually get invited to the White House to talk about different issues. I ran into a Pottawatomie County supervisor at the White House. I didn't even know he was going to be there. So it's really pretty incredible, the openness of this administration. So, you know, some Republicans won't like the fact that he is reaching out to the Democratic caucus. But for heaven's sakes, again, you know, we need to engage in discussions. So it's night and day. And I love the quote, President Ghani of Afghanistan, he even said that yesterday at the United Nations, that the difference between this administration and the previous administration in regards to an actual strategy to end the conflict in Afghanistan is night and day. Thank you.
Next up is Ashlyn Bauer from Charles City, and she'll be followed by Harry Shoup from Mason City.
Hi. You have made comments on wanting to get rid of the Department of Education, and I just want to know, how is this what is best for the public school system?
I think that, yes, I think our Department of Education at the federal level can go. Not to say that there can't be collaboration between our states at the state level, but we have a federal Department of Education that, again, believes that one size fits all. And I don't think that's right. We have different types of populations in different areas, and the populations in Texas may be different than the population that we have here in Iowa, may be different than the population or the different school districts you might have in New York City. And so I think that those that best know how to meet the educational needs of the students are those that are actually closer to the students. So again, one size doesn't fit all. I've seen schools that have been able to do multi-grade classrooms and engage in that, and whatever works for their students, we want to enable our states and our localities to do that. Your school board, your school administrators, your teachers, and your parents know best how to educate their own students. So I think that we can. That's a lot of spending at the federal level for bureaucrats that will sit in an office making decisions about your education when they don't really know about the locations they are trying to educate. So closer to the people is always better, in my opinion. I'm going to give an example, too. A few years ago, we voted for the Every Student Succeeds Act in the United States Senate and Congress. It was passed into law, huge bipartisan support amongst Democrats and Republicans, signed into law by President Obama. It returned most control back to the states. And so I'm thinking with all of that local control going back to the states, certainly there will be people at the Federal Department of Education that won't have a need to be there anymore. Nobody was laid off. We still spend a lot of money. The people that have those jobs are just put elsewhere to do other things, and we continue to spend federal dollars in an agency when we should be spending those dollars right here.
Next up is Carrie Shoup from Mason City, and she will be followed by Lucian Schmidt from Charles City.
Hi, Carrie.
I was just I've been really concerned about the tweets and the unhealthy things that have been said by the president, and just don't know what you think about what he's said.
He needs to put the phone down. I would agree. There are a number of tweets out there that we wish maybe he wouldn't do. You know, that's his way of expressing himself. Sometimes I don't agree with everything that he tweets out, and I've been able to state that I don't agree with everything that he says, and I feel okay pushing back on that. It's unusual. Yep, to him, you bet, and he says we'll agree to disagree. So. So, you know, he hasn't been happy about some of the talk I've had, you know, with his travel to Mar-a-Lago early on. That was something that I was quite vocal about, and I brought up to him. You know, there are a number of other issues that we've had to deal with. So I do believe in being respectful. I think that's important, and would like to see respect coming from all levels of our government, and I love to see it coming from our civilian population as well. And I have to say, this has been a really civil discussion, even though we may disagree on a number of things. At least I'm able to take notes and hear what your thoughts are. So I do appreciate that. A lot of people think his tweets are okay, but yeah. Oh, I didn't see that. I'm sorry. That's not appropriate. Yep, not appropriate.
So next up is Lucian Schmidt from Charles City. And following that will be Kate Hackman from Charles City.
Thanks for coming, Senator Erst. I was wondering where the H.R. 5 regulatory bill is at in the Senate.
What was the name of the bill?
H.R. 5.
What was the name of it, though? I don't know the House bills, the House numbers.
Okay, the regulatory reform.
Okay, I would have to go back and double check, and I'm happy to get some information on you and see where it is, either on the committee process or where it is right now. We do want to see regulatory reform, and I think that is really, really important. I need to take a look at the schedule and see where we are with that bill, and I can get back to you. But, yep, give me your information, and we'll go back and find out for you. I appreciate it. So, yep, thoughts on regulatory reform. We know that it is necessary. It has to happen. That is one of the things we believe is very important to getting our economy going again. There's a lot of regulation on the books out there that it doesn't make sense anymore. Regulations that were passed in years past, we've got to reevaluate those. So thank you.
Next up is Kate Hackman from Charles City. And she will be followed by Michelle Crumwide from Charles City.
Thank you, Senator Ernst, for taking my question.
Thank you.
I actually have a question and a comment.
Mm-hmm.
In terms of, we've been discussing healthcare all morning here.
Mm-hmm.
On a personal note, as a woman to a woman, as a mom to a mom, I'm a nurse. I work in the trenches.
Mm-hmm.
The attack on women's healthcare in every single one of these bills that is coming out of the Republican Party to try to repeal and replace this Obamacare is attacking women left and right. It's cutting access to women's health care through Planned Parenthood and the Decorah office that was closed. 800 women in northeast Iowa lost their health care because that clinic closed. I'm a nurse in the trenches working every day, seeing what we can do in health care, how wonderful it is. I understand Obamacare has issues. It needs work. I get that. But these attacks by the Republicans and the health care bills, look at Grassley yesterday. He honestly came out and said it doesn't matter what crosses his desk, he'll sign for it because it's a repeal and replace of Obamacare. That's it.
Well, I can't speak for Senator Grassley. I will go back to Planned Parenthood, though. Now, Planned Parenthoods have been closing across the state of Iowa long before these were enacted. So they were closing during the Obama administration. So I wouldn't say that it's all due to the thoughts that we have on defunding Planned Parenthood. And again, some of those federally qualified health clinics have already stated that they can absorb the closure of Planned Parenthoods. And there is at least one federally qualified health clinic in every community that, at least this is the information that we've been provided by the federal clinics. There is one in every community that has a Planned Parenthood except for the one that is in Iowa City. And they are covered by a different system. So to say closing Planned Parenthoods is attack on women's health care, will tell you there are a lot of comprehensive things that can't be done at a Planned Parenthood. Women will still have to go somewhere else to have mammograms done. They are not done by Planned Parenthood. Planned Parenthood receives over half of its funding from private donors and other ways of generating dollars. They also contribute millions and millions of dollars directly from their operating into PAC activities. So they're out there running ads against politicians that might disagree with them, instead of spending those millions on women's health care. So I don't have any problem with redirecting. If women want to support, if donors want to support, I think that's okay. If they want to support those clinics, that's great. They can do that with their dollars. But for us to support the nation's largest provider of abortion services, it is not stopping access to women's health care.
I do just have one quick comment on the DACA. You talked earlier just about DACA and their ability to be able to become citizens of the U.S. And that would entail them getting jobs, them becoming part of the workforce, going to school. They're here, they're doing that already.
Sure.
That is the point of the DACA program. They're here, they're working, they're adding to our economy.
And give them permanent status.
Give them permanent status. They deserve it.
That's what I said.
They're our neighbors. They're our
That's, I agreed with you.
It's wonderful.
Our final question is from Michelle Conrad from Charles City.
Hello, Joni.
Hi.
Thanks for taking my call, or my call,
Yeah,
my
thank
question. But I will call you later. No, my question is on healthcare. I am one of the lucky 72,000 Iowans that got their cancellation letter yesterday.
I'm sorry.
Celebration. Blue Cross Blue Shield. Medica, my premium would be astronomical. So do you know when the Cassidy Graham bill will come to vote? And will you vote yes for it?
I am leaning yes. Yes, I am leaning yes. But I will caution you, and I'm sorry. I'm sorry that happened. And here's a real live person who just got their cancellation notice from Blue Cross Blue Shield. With Medica, I don't know that you will find reasonable rates, and that's why we're looking, and that's why Lamar Alexander was working really hard to find something that would fall into place soon. And that's what the Democrats rejected. It was really hard.
My premium also with Blue Cross Blue Shield was quite $12,000 a year, and pre-existing condition. But ACA definitely needs more than tweaking. It needs to be replaced, repealed. It's for Americans. We farm, so we purchase our own insurance. So it's a hardship on us also. So we want to thank you for working for us.
Yeah, thank you. I appreciate that, and thank you for being willing to stand up and share that, because if those rates aren't affordable, just as I described with that family of 4 that has to purchase their insurance individually, they won't have insurance, period, which the ACA claimed it would make sure everybody had affordable insurance, and that hasn't happened. So we have got to find that answer. With the Graham-Cassidy bill, unfortunately, that would not start until 2020. Even if we got it passed, it still would be 2020, and that's why with Iowa, they are seeking a stopgap measure right now through the state, and the insurance commissioner has done a very good job at trying to figure out a pathway forward for folks like you. That has not been approved by CMS yet. We are hopeful that will happen very soon, because we have to have that information so that you can purchase insurance that is affordable, at least somewhat affordable. So thanks for sharing that. I do appreciate you stepping up. Okay. Yeah, I'll do one more, yeah.
Our last question will be from Tammy Hott from Nashua. Tammy?
Senator Ernst, thank you. I also believe in being Iowa nice and respectful. However, my life is on the line. I've been living with HIV for 24 years. For the first 6 years, I lived in silence because of the discrimination, stigma, fear, ignorance, shame, and hate. My husband died of complications of AIDS on October 12th, 1996. I moved home to Iowa to have our son. Our son was born 2 months and 9 days after my husband died. I was living to die at that time because we did not have the advances that we do now. I never thought I would live long enough to see my son graduate. He walked across the stage to receive his diploma in 2015. On December 27th, 2016, he made me a grandma. I am living to live, but I need access to my care, treatment, and life-saving medications. I will die without them. Healthcare saves lives and families. I survived AZT. The HIV community survived Ronald Reagan. This is so important to me. I was arrested outside of your DC office on July 22nd. We will not let this Tea Party, GOP, kill us now without a fight. Kill the bill, don't kill us. Graham Cassidy is one of the worst versions of the healthcare, the repeal healthcare that has come out. How can you support it? Senator Grassley said last night that he couldn't name something good in it, but he was going to vote for it because politically he had promised. That's a piss-poor way to run a government. This is my life. I will die without health care.
And thank you for sharing your story too. And we want to make sure that as we move forward that we take innovation into account. Probably the prescriptions you were on, I would maybe want to know more about that. And again, getting back to the cost of health care and finding an affordable way to maintain your quality of life and make sure that you do live a long and happy life is very important. So thank you for sharing your personal story, Tammy.
Please, kill the bill. Don't kill us. Kill the bill. Don't kill us.
Thank you for coming today, everybody. I do appreciate it. And thanks for sharing your opinion on so many different issues. I think going back, DACA and probably healthcare issues are the two biggest issues that we will have to face in the near future. So God bless you all. Thanks for coming out today.
Thank you.